Good evening. In a society where mental health challenges are on the rise, the need to manage mental health and well-being has never been greater. Ensuring treatment outcomes are measurable to improve patients' quality of life has become crucial. Tools like the Mental Health Questionnaire-14 allows healthcare providers to assess and track improvements in patients admitted to mental health facilities, focusing on aspects such as vitality, social and emotional functioning, and general mental health. And for more on this, so we're now joined by Counselling Psychologist at Life Health Solutions, Safia Joseph, and she joins us now via our video link. Safia, thank you so much for your time this evening here on SABC News. I mean, a very important thing that I'd like for you to firstly outline for us, and of course it is that Mental Health Questionnaire-14 tool. Tell us more about it.
Good evening, Mbali, and good evening, viewers, and thank you for the opportunity to tell you about mental health. I think an ever-growing and more important topic in South Africa and globally. So the Mental Health 14 questionnaire is one that is fairly widely used. It's an international standard test. It's a self-report tool, right? So it's designed to assess mental health symptoms and their impact on one's daily functioning. And I think you've spoken about the 4 dimensions that it measures against. So things like vitality and how energetic and fatigued the person might feel, their social functioning, so how their physical or their emotional problems might impact on their normal everyday social activities. It also looks at things like role functioning, so their emotional functioning and how this might impact on work, right, and other daily activities. And then other general mental health related issues, right? So the symptoms of depression or anxiety or any kind of emotion regulation control issues that the person might have. And it's really important that we understand how mental health impacts on us on a daily basis, because early intervention is key. So the earlier we find out how somebody is feeling on that mental health continuum of whether they're excelling and thriving or whether they're in crisis, the better we'll be able to intervene and the earlier we'll be able to render care.
And talking about that, one would also ask, in what way is the MHQ-14 tool effective in terms of assessing patient outcomes, particularly looking at mental health issues?
So there are a number of benefits. I think that despite the fact that it's a 14-item questionnaire, so it's quite brief, it does provide quite comprehensive coverage when you look at the dimensions that I've mentioned. But I think in addition to that, it is patient-centered. So it's very much a self-report tool, and it empowers patients to provide their own perspectives on what their mental health is. And that leads to more accurate and meaningful data. So interventions can then be based on what the person is going through, as opposed to what the clinician might think and interpret their symptoms to mean. And it's quite efficient, right? So it's quite quick to complete. And I can tell you that in our mental health facilities, so whether it's through the Life Health Solutions Employee Wellness Program, or whether you're looking at our inpatient facilities, so the Mental Health and the rehab facilities, what we do is that we administer it right at the beginning, so pre-admission. And then again, just before the person is discharged. So we're able to offer continuous care, it's end-to-end care, and we're able to ascertain how important this is from a patient experience point of view, in addition to the clinician experience.
And I don't know if maybe you can take it a bit more further and a step further in terms of, when it comes to patients taking this questionnaire, what have you found as, the commonalities in a number of people suffering from mental health? What do you think are the contributing factors that you have managed to find from this questionnaire?
Yeah, I don't think it's any surprise when we look at what we're going through these days, the escalating food prices, fuel prices, and what people are experiencing on a day-to-day basis. Our large target audience within the Life Health Solutions is employees at work. And when we look at things like, job insecurity, burnout, work-life balance issues, all of these trends are picked up in that tool that we use, but also in our clinician experience and the interviews that we do with patients, that people are really taking strain, and this is impacting on their mental health. And we want to arrest any kind of mental health issues before it gets to the point of mental illness. And that's part of that mental health continuum discussion.
And what are the strategies are then used, to help some of these patients when it comes to mental health after they've taken this questionnaire to help them improve their lives?
People need, once they're discharged and whatever the care might be, whether it's at the mental health facility or even if it's outpatient care, they need to feel equipped to return to work and their family lives post-treatment, right? And that needs to be a combination of practical strategies, emotional strategies, and social strategies. So gradual reintegration, I think, is key. So engaging with employers on a phased return to work plan often helps, and any kind of workplace accommodation that needs to be provided, so reasonable accommodations, so flexible hours or modified duties, for example. I think skill development is really important in how people understand what it is they're experiencing and the do's and don'ts on a very practical level. And then emotionally speaking, I think counseling, therapy, support groups, one-on-one counseling that builds somebody's resilience, that it's not simply about bouncing back, it's about bouncing forward. So once we deal with adversity, we need to understand how we can help the person understand their new version of themselves and how they can cope with that. And then, of course, family and social support is key. So family members also need to be a part of that treatment regimen because they need to understand what their family members might be going through and what treatment might be necessary and the role that they have to play. And the same from a community point of view. And I think all of this is key if we are going to break that stigma around mental health. It's really difficult when somebody is trying their best to reintegrate into work and home, and what they get from the people around them is a lack of understanding of what they're going through.
Yeah, and perhaps what is your advice, to South Africans who may not know that they are suffering from mental health? What do the symptoms look like, and how do they present themselves so that they can try by all means to reach out to someone and get the necessary help?
Yeah, I think that we should all be doing an internal check-in. So some introspection. And in the same way that from a physical health point of view, if I had a sore throat and a runny nose and I was feeling a bit under the weather, I would reach out to a doctor. I would go and see my GP and to say that I'm not feeling very well and what could I do. From a mental health point of view, we need to do those internal check-ins to see whether it's something, whether we're feeling on top of our game. Because too often what happens is that people procrastinate. When they're not feeling well, they hope that tomorrow will be a better day. Or the people around them might say, just think positive thoughts. So being in tune and in touch with what we're feeling and limiting the negative self-talk, this expectation that every day is going to be a great day. I think we need to realize and cut ourselves some slack that it's okay to not be okay. And that when we're feeling that way, that we reach out for help, whether that's initially to a family member or a confidant that you trust, perhaps at work it's a colleague or your line manager, or maybe it's a professional, and realizing that just because you're not feeling okay and you reach out to a professional does not make you weak, it makes you human. Because anything that comes at the cost of our mental health is too expensive.
All right, Safia, thank you so much for your time this evening. That is Safia Joseph. She is a counselling psychologist, just giving us her insights in terms of that very important questionnaire. It's called the Mental Health Questionnaire-14 and is a tool to help many deal with the effects of mental health.